I want you to think about the last time you went to bed completely exhausted, every muscle in your body ready to stop, your eyes heavy, and then your legs started, that crawling sensation under the skin, that urgent, impossible need to move that no amount of willpower could stop. You shifted position, you kicked the covers off. Maybe you got up and walked the hallway at 2 in the morning just to get some relief, and you told yourself, "This is restless legs. My doctor told me to take magnesium. My doctor told me to stretch before bed." Today that changes, because what you were told is not wrong, it is not complete. And the part your doctor left out is the part that actually repairs the problem at its source. Johns Hopkins researchers published data showing that in adults over 60 with restless leg symptoms, 92% had measurable ferritin levels below the threshold the nervous system requires to maintain dopamine regulation in the lower extremities. 92%. That is not a coincidence. That is not a sleep disorder. That is a nutritional signal your nervous system has been sending, and the clinical system has been handing you a prescription instead of an explanation. I am Dr. Laura Candy, physician, public health researcher, and for 15 years of clinical practice, I sat across from patients who were told their restless legs were a neurological quirk, something to manage with medication, something to endure. 15 years of clinical practice showed me that when we stop treating the symptom and start reading the signal, the legs begin to settle. And the signal here is almost always the same. Harvard's research on the dopamine synthesis pathway confirmed what the Johns Hopkins Ferritin data already indicated. Iron is a required cofactor for dopamine production at the cellular level. Without sufficient iron stored in the body, the dopaminergic neurons that regulate your leg muscles at rest begin to malfunction. The signal that tells your legs to stop moving does not arrive cleanly. It fires erratically, and what most male doctors hand you in that situation is a drug that mimics dopamine without ever asking why your dopamine system stopped working in the first place. That is the question I am answering today. Think of it this way. Your motor neurons are the foremen of a factory floor. When dopamine signals are strong and precise, the foremen know exactly when to run the machines and when to shut them down for the night. When the dopamine signal is disrupted because iron is running low, the foremen lose their schedule. The factory keeps running at 2 in the morning when it is supposed to be closed, and here is where it gets worse for adults over 60. Clinical studies showed that iron absorption efficiency in the gastrointestinal tract declines measurably after 60. You can be eating adequate iron in your food and still have falling ferritin levels because the gut is no longer extracting iron the way it did at 40. Your standard blood panel checks hemoglobin. Hemoglobin only drops when iron depletion is severe. Anemia is the final stage. The dopamine disruption begins far earlier when ferritin falls below 50 nanograms per milliliter. Most physicians do not check ferritin unless you specifically request it. Most do not connect a ferritin number to restless legs even when they see it. That gap between what the standard of care measures and what the nervous system actually requires is where your legs have been living. And at the end of this video, I am going to reveal the food that most people drinking it every night believe is helping them for the wrong reason entirely. They think it works because of melatonin. The 2020 sleep medicine clinical study found something completely different happening inside the gut. The results surprised the research team. Stay with me until the end. If you are watching this and you are over 60, pay attention to every word coming next. The first food is spinach. And before you move past this because you already knew it, let me tell you what almost everyone gets completely wrong about how spinach actually repairs the iron dopamine problem. Spinach contains non-heme iron. That is the plant form. It is less immediately absorbable than the heme iron found in animal protein. That is the part most people know. Here is the part that changes the clinical picture entirely. This was confirmed by research at the University of California studying iron bioavailability across dietary patterns in adults over 60. Non-heme iron absorption increases by more than 300% when consumed alongside vitamin C at the same meal. Not the next day, not an hour later. At the same meal, 300%. That is not a marginal improvement. That is the difference between spinach as a food and spinach as an intervention. Think of it this way. The spinach alone is not the medicine. The combination is the medicine. Spinach consumed without vitamin C in a gut that is already absorbing less than it did 2 decades ago delivers modest iron that moves ferritin slowly. Spinach consumed with half a lemon squeezed over the top, or alongside bell pepper, or with a small glass of citrus juice at the same meal, That is a clinical intervention dressed up as lunch. The cooking form matters as well. Lightly cooked spinach has lower oxalate content than raw spinach. Oxalates bind iron at the intestinal wall and block absorption. 2 cups of spinach, sautéed briefly in olive oil, with half a lemon squeezed over the top. That is the daily protocol for this food. Every day, not twice a week, daily. 15 years of clinical practice showed me that consistency with this single adjustment moved ferritin numbers in patients whose legs had not responded to anything else they had tried. The second food is pumpkin seeds, and I need to explain something that most discussions about restless legs skip entirely, because it requires understanding a second mechanism running in parallel with the iron dopamine problem. And if you miss this second mechanism, the first food does only half the job. The neuromuscular junction is the actual physical connection point where the nerve signal meets the muscle fiber. That junction requires magnesium and zinc to maintain its stability threshold. When the junction becomes unstable, the muscle can misfire at rest even when dopamine levels are adequate. 2 separate mechanisms, 2 separate targets. Most doctors address neither one. This was confirmed by research published in the Journal of Neurophysiology, showing that in adults with restless leg symptoms, neuromuscular junction instability was measurable and present independently of dopamine disruption, not instead of. In addition to, pumpkin seeds address this second mechanism directly. 1 ounce of raw pumpkin seeds delivers approximately 150 milligrams of magnesium and close to 2 milligrams of zinc, both in forms the gut absorbs without the competition problems that affect mineral tablets. Think of it this way. Iron work repairs the signal. Magnesium and zinc work stabilizes the junction that receives it. You can restore the dopamine signal perfectly and still have the muscle misfiring at rest if the junction is unstable. Both targets require attention. 1 small handful of raw pumpkin seeds every evening, not roasted, not salted. Roasting reduces magnesium availability by approximately 20%. Raw, every evening, now. Those first 2 foods address the dopamine supply line and the neuromuscular junction. That is a solid foundation. But here is where this becomes something most health content never reaches, because the third and fourth foods operate through pathways that neurologists and general practitioners have almost never discussed with restless leg patients. Not because the science is new, because the specialties have not connected the findings across departments. The third food is walnuts. Your dopaminergic neurons have cell membranes. Those membranes are dynamic. They require specific fatty acids to remain permeable enough to transmit signals with precision. When membrane fluidity drops, signal transmission slows. When signal transmission slows in the neurons controlling your legs, the threshold for involuntary movement drops. The legs become easier to trigger at rest. Clinical studies showed that DHA, the long-chain omega-3 fatty acid, is the primary structural component of neuronal cell membranes throughout the peripheral nervous system. When DHA is insufficient, membranes stiffen. A stiffened membrane transmits dopamine signals slowly and imprecisely. At night, when the body is trying to rest and precise inhibitory signals matter most, that imprecision becomes a problem you feel in your legs. Think of it this way. A well-maintained neuronal membrane is a clean fluid channel. The dopamine signal passes through exactly when it should. A membrane depleted of omega-3 is a partially blocked channel. The signal still passes, but it is delayed and irregular. And irregular inhibitory signals at night feel exactly like restless legs. Walnuts are the highest plant-based source of ALA, the omega-3 precursor the body converts to DHA. The conversion rate is modest, which means walnuts work best as part of a framework that also includes fatty fish on other days. But as a daily dietary addition for membrane maintenance in adults who are not eating fish regularly, walnuts are the most practical intervention available. 1/4 cup of raw walnuts daily, with your largest meal. Not alone, not on an empty stomach. The fat content in the meal improves ALA absorption significantly. Every day, with the meal, the fourth food is fermented kefir, and this is where the mechanism goes somewhere that will genuinely surprise you. Your gut microbiome produces L-DOPA, the direct precursor to dopamine. Not a trace amount, a clinically meaningful contribution to dopamine availability throughout the body. including in the peripheral nervous system that regulates your legs at rest. This was confirmed by research published in Nature Reviews Neuroscience, establishing that specific gut bacterial communities directly influence dopamine synthesis and peripheral dopamine signaling. When the microbiome is disrupted, which in adults over 60 happens routinely through medication exposure, dietary changes, and declining gastric acid production, the gut's L-DOPA output drops, less L-DOPA reaching the dopamine pathway, less dopamine available for the motor neurons controlling your legs. Think of it this way: your gut is a second dopamine factory. Most people have never been told it exists. Most physicians who treat restless legs have never asked about gut microbiome composition. When that factory slows down, the legs lose a supply line that restoring dietary iron alone cannot fully compensate for. Research from the APC Microbiome Institute at University College Cork in 2021 showed that specific lactobacillus strains present in fermented dairy reactivate L-DOPA precursor pathways in gut microbiome models. The mechanism requires live bacteria in sufficient concentration. Pasteurization destroys up to 80% of viable bacterial count. Shelf-stable kefir is not the same product as refrigerated, unpasteurized kefir. Half a cup of full-fat refrigerated kefir, unpasteurized, consumed with dinner. Every evening, the bacteria reach the gut alongside food, which provides the substrate they need to reestablish the L-DOPA production cycle. Now I need to tell you something about the clinical failure pattern I have seen more than any other in restless leg cases. Because a significant number of people do exactly what I have described and see partial improvement. The legs are better, the episodes are shorter, but they do not resolve completely. And the reason, in 15 years of clinical practice, traces almost always to a second absorption failure that the medical system overlooks almost entirely. After 60, B12 absorption from food declines in parallel with iron absorption. The same age-related changes in gastric acid and intrinsic factor production that reduce iron uptake also reduce B12 uptake. B12 deficiency is extraordinarily common in adults over 60 who are on proton pump inhibitors or metformin. And B12 deficiency progressively destroys the myelin sheath that insulates the motor neurons carrying dopamine signals to your legs. A demyelinated nerve is a noisy nerve. It fires imprecisely. It fires at rest. And a physician looking at that presentation sees restless leg syndrome without ever checking whether the underlying nerve architecture is being actively damaged by a B12 deficit that a standard panel did not flag. This is not the fifth food. This is the context that makes the fifth food's mechanism make complete sense. Sardines 3 times per week address both B12 and omega-3 in the highest bioavailable dietary form available. 1 tin of sardines delivers more than the complete daily requirement of B12 for an adult. If your legs have not fully responded after 6 weeks on the iron and kefir framework, B12 absorption is the variable to investigate, and sardines are where you start. Before I give you the complete protocol, check that you are subscribed. Every video this week covers a different leg warning signal your doctor has probably never explained. Tomorrow covers the one most people have been told is just poor circulation. Do not miss it. The fifth food. I told you at the start that most people consuming this every night believe they are taking it for the wrong reason. They have heard it contains natural melatonin. They believe the sleep benefit comes from the melatonin. That belief is not completely wrong, but the Sleep Medicine 2020 randomized controlled trial examining 64 adults over 60 with documented restless leg symptoms over 12 weeks found something the researchers did not expect. Symptom severity and episode frequency correlated not with sleep architecture changes, but with ferritin level improvements in the responders. Tart cherry juice was not working through melatonin. It was working through iron absorption. The fifth food is Montmorency tart cherry juice. The mechanism is anthocyanins, the high-concentration red-purple pigments that give Montmorency cherries their color. Clinical studies showed that dietary anthocyanins reduce chronic low-grade inflammation at the intestinal mucosa. Gut mucosal inflammation is one of the primary barriers to non-heme iron absorption in older adults. An inflamed mucosal lining has reduced absorptive surface area and altered transporter protein function. Iron passes through less efficiently. Ferritin climbs slowly. Anthocyanins reverse that inflammation. The mucosal lining recovers its absorptive function. Every iron-containing food you eat becomes more effective because of what the tart cherry juice is doing to the absorption environment. This was confirmed by research published in the Journal of Nutritional Biochemistry, showing that anthocyanin-rich extracts directly reduce inflammatory cytokine expression in intestinal epithelial tissue. Think of it this way. The gut inflammation after 60 is a locked gate between the food you eat and the ferritin your dopamine system needs. Tart cherry juice does not supply the iron. It opens the gate. Every other intervention in this protocol becomes more effective because of what the cherry juice does first. And here is why the timing is not optional. Clinical studies show that consuming the juice 30 to 45 minutes before bed produces significantly stronger effects than morning consumption. The gut has the longest uninterrupted contact time with the anthocyanins overnight. More surface exposure, more inflammation reduction, more iron from that day's meals extracting into the bloodstream during the overnight window. 8 ounces of Montmorency tart cherry juice, unsweetened, 30 to 45 minutes before bed. Not a blend, not sweetened. 100% Montmorency, unsweetened, refrigerated, and before the complete protocol. I want to address something that most people applying this framework get wrong, because the foods are only part of the equation. The sequence and the timing rules are what determine whether the framework produces results or produces partial benefit. Getting the right foods at the wrong meals is like having the right keys in the wrong locks. And the most important part is this. Here is the exact protocol, confirmed by Mayo Clinic's Nutritional Intervention Guidelines for ferritin optimization in older adults. With lunch every day, 2 cups of lightly sautéed spinach with half a lemon squeezed over the top. Cooked in olive oil. The cooking reduces oxalate. The lemon triples non-heme iron absorption. This is the ferritin-building meal. Midday, not morning, because iron absorption peaks in the first half of the day for most adults. With dinner every evening, half a cup of full-fat refrigerated kefir, unpasteurized, consumed with the meal. 1/4 cup of raw walnuts with the meal. 1 small handful of raw pumpkin seeds after the meal. The kefir arrives first to prime the gut environment. The walnuts and seeds follow to deliver omega-3, magnesium, and zinc in the same absorption window as the kefir's bacterial reactivation cycle, 30 to 45 minutes before bed. 8 ounces of unsweetened Montmorency tart cherry juice, undiluted. The anthocyanins work overnight. The mucosal inflammation decreases. By morning, the absorption environment is measurably different from the night before. The protocol runs for 12 weeks. Ferritin levels move slowly. Neuromuscular junction remodeling takes months, not days. Partial improvement arrives earlier. Full resolution requires the full 12-week window. Do not assess at week 4 and conclude it is not working. The red line is calcium at the same meal as your iron source. Dairy products, calcium supplements, high calcium foods at the same meal as the spinach, they compete directly with non-heme iron at the intestinal absorption site and block the majority of what would otherwise enter the bloodstream. The spinach meal must be dairy-free. This single error is the most common reason adults report that dietary changes did not work for their restless legs. If this is the first time anyone has explained the connection between iron, gut inflammation, dopamine, and what is happening in your legs at night, subscribe. This is the kind of evidence-based breakdown I publish every day this week. Drop your age in the comments below. I read every single one. Tomorrow's video covers a symptom that affects almost every adult over 60 who stands for more than a few minutes. Cold feet and cold legs that no amount of extra socks or blankets ever fully resolves. Most doctors call it poor circulation. That framing is not wrong, but it stops before the actual mechanism. The compound that controls whether your lower extremity blood vessels open or stay constricted drops by 60% between the ages of 40 and 70. Johns Hopkins documented it. There is one specific food that begins shifting that compound within hours of the first dose. Tomorrow, do not miss it.